Now there's lots of things that we can do for our shoulders to increase stability, and on the other side of that spectrum, to increase mobility or flexibility. And we want both for happy, healthy shoulders. So this exercise sometimes can help rebalance a little bit the rotator cuff muscles, which are a group of 4 muscles that kind of help hug the arm bone into the shoulder socket. And these 2 exercises that I'm going to share with you today may not be the end-all be-all or fix some shoulder pain, but sometimes what they can do is to help bring a better alignment or relationship of the arm bone into the shoulder socket. Sometimes they need to be coupled with other strengthening exercises or mobility exercises to help the shoulder regain its right placement or right alignment. But the shoulder is one of the most mobile joints in the whole body. So sometimes I feel like depending on what we do in our day and how we use our arms and our shoulders, they can get kind of patterned into a direction that maybe is not as balanced, which then can sometimes lead to pain and discomfort. So these 2 today, we want to have that Ortho-Bionomy lens, which is to do less is more, and to really listen for our own self-corrective response within the body. So the first thing we're going to do is to find a bone, the end of our scapula bone, which actually comes all the way to the front of the body here, and it's called the coracoid process. So if you find your clavicles or your collarbones, and you go right underneath and you walk your fingers out, you're going to come usually to a little divot, or you might feel like a little finger-like protrusion, a little knobby area there. That's called your coracoid process. And it actually is part of your scapula or your shoulder blade back here. But this is the point that we're going to cave around, we're going to soften into, we're going to shorten the tissue in that area. So with one finger there, just monitoring that area, we're going to bring that same arm across the body and bring the palm facing out. Again, if that feels comfortable. It may feel like it's a little bit more, creates a little more slack in that area to turn the palm forward. So be curious for yourself. And then I'm going to use a wall here to help me compress. So facing the wall, we're going to bring the elbow somewhere in line with that shoulder. Maybe it's a little higher, a little lower. Be a little bit picky here about where can this tissue soften the most. So I'm just exploring a little bit for my own body. What angle do I need to bring my hand, my arm at so that that tissue really softens? Then from here, I'm going to gently compress that elbow into the shoulder by just gently leaning towards the wall a little bit. And as I start to lean, I recognize, oh, I think I want it just a little bit higher. There we go. And then I can really find that clear connection from the elbow to the shoulder. And here's where maybe you take a deep breath, maybe you listen internally for your body to notice what's happening. And then I felt a little bit of this sort of percolating, bubbling experience where I now feel like, oh, my shoulder, my arm wants to come out of that position. And maybe I give it a little wiggle, maybe a little integration of some movement there. And then maybe you notice a difference between one side and then the other. Maybe you palpate again that shoulder area and notice if there's any more softness. Or you can move your arm around, notice if there's a little bit more change in the mobility of your arm. So that's the first exercise. The second one is called our shoulder point number 2. And it's going to be in this little V shape that is formed by the clavicle or the collarbone here and the top of the scapula. So if you palpate in that kind of soft tissue area, you'll come to a little V in the middle. And that area can be very tender for some of us. So that's another area in Ortho-Bionomy that we're going to try to soften the tissue around it. And that looks like bringing the elbow out directly to the side. So again, play with the angle here. For some of us, it may need to go a little higher to soften that tissue under your finger. For others, it may be a little lower. Maybe you rotate in or out a bit, but play with where can that shoulder soften, relax, and the tissue under your finger is really supple. And then once you find that angle, we're gonna add a little bit of, just a slight bit of compression from my shoulder to the elbow, from my elbow to the shoulder, right into that joint. And then again, I'm going to pause and listen, noticing if my body can recognize the input that's happening, and my nervous system then creates a response that allows my arm to come out of that. And then I would just recheck again, does that tissue under my fingers feel a little softer? It does for me. Can I mobilize that arm just a little bit more? Maybe integrate it with some nice swimming or dancing with your arm movements. And then feel the difference. And then try the same thing on the other side. So I hope that helps increase a little bit more awareness at the shoulder joint and a little better balance for those muscles in the rotator cuff area. Thanks for joining me today.